Okay, welcome to the Medcan webinar, the first of the Medcan Presents, the latest on COVID-19. This is a webinar with Medcan CEO Shaun and Dr. Peter Nord. It's the first in a regular series of webinars that will be happening on Tuesdays and Thursdays at 12:30 p.m. Shaun is the chair and CEO of Medcan. He's the author of the best-selling book, Eat, Move, Think, The Path to a Healthier, Stronger, Happier You, and he's the host of the podcast, Eat, Move, Think, available on your favorite podcast platform. He's also the founder of True Patriot Love, Canada's national foundation to support veterans and military families. Dr. Peter Nord is the Chief Medical Officer of Medcan and the President and CEO of Stillbrook Retirement Residences Incorporated. He is an assistant professor at the University of Toronto. Dr. Nord trained at McMaster University and the University of Toronto. Shaun, why don't you start with an update of the pandemic from Medcan's point of view?
Yeah, hi everyone. Great to have you join what will now be a regular webinar featuring Medcan experts. We've been really ramping up our presence on social media, as has, I'm sure, all of you folks, whether it's purely social or commercial. Just a quick update on Medcan. We've been following the pandemic for months now, and in fact, I wrote an op-ed regarding it, in February, predicting somewhat that we would have certainly an urgent crisis in Canada that might overwhelm our hospital systems, but never did I fully imagine that the globe would be fully locked down. What does that mean for Medcan? It means that our non-essential services, such as our annual physical and our fitness training and our other specialty services that we provide on-site in downtown Toronto, have effectively been shut down, but we remain open for sick care, which is an essential service. Thank goodness, and fortuitously, about a year ago, even longer, we embarked on a huge digital and technological renovation of Medcan that at the time I thought was crazy expensive, but necessary. But again, never did I imagine how necessary it is. So Medcan has been thankfully able to function completely with our entire back office team now work from home. And all of our services, so even the non-essential services such as the annual physical and fitness and weight management and mental health, all of these are now virtually enabled. And even fitness, I believe we're actually doing probably one of the most numbers of virtual fitness sessions of any facility, certainly in North America right now. So it's been amazing to see how our team has responded. All of our physicians are now online and they're able to work from home. And we are moving all of our patient traffic to the degree we can to a virtual visit first. And that's to keep everyone safe. And Dr. Nord will talk a little bit more about that. But in short, if we can resolve your situation without you physically having to see us in person, then that keeps everyone safe from the virus. And that said, we still have our urgent care site open and fully functioning. So we have on-site lab, imaging, physicians, and nurses. But again, it's been surprising how much we can actually resolve on a virtual visit and then get to your prescription refill or other sorts of advice virtually or by delivery. So really glad to see all of that coming together. Medcan will continue to be open to you. Everything is available online. It's amazing how much we can actually do. I think people are a little bit cautious, like, is this going to be the same as doing it in person? And of course, we have been too, because this is a new world for all of us. But we've had some amazing feedback on just how well it's going, and even doing your annual physical online has been extremely successful. We do an in-home blood draw and full protective equipment, and that really is the foundation for then allowing all of our professionals to interact with you virtually with the whole platform of information. We also, as some of you know, have a food business named Nourish, and that previously did corporate catering and catered Medcan. And that now has been in full flight catering our clients at home with pantry restocks, of which I'm a a participant or a grateful customer for. So right, with that, I know we don't have a lot of time. I'm going to hand it back to our host, Chris Shulgan, to MC the many questions that have come in.
Thanks, Shaun. Now we'll hand it over to Peter Nord, Dr. Peter Nord, who will talk about Medcan and the how the fight against the pandemic is going.
Thanks, Chris, and thanks, Shaun. Yeah, we've I kind of describe these days as the end of the beginning, as opposed to are we at the beginning of the end? I think we're probably closer to the beginning of the end, as opposed to different ways of looking at it. Either way, we're well into this at this point. Certainly, I've noticed the questions that have come in over the last couple of weeks were different from the kind of questions that were being asked a couple of weeks previous or even a month previous. I think obviously the general level of understanding across our broad population is getting higher as you know, the media only are following basically one story on all channels, so it's hard to not sort of keep up with stuff. So, you know, initially questions were relatively, you know, simple, sort of basic understanding. Now we're getting to responding to what's happening in the media, either of the day, of the hour, of the week. And so a lot of the questions that we're fielding really have a lot to do with, you know, the subtleties of what's happening. And especially now that we are, you know, well into the social distancing and the staying at home, it's starting to wear on people. And certainly the mental health challenges are really starting to come out. And so I know at Medcan, we have a whole mental health program, and our professionals thankfully can do so much of this, as Shaun was saying, remotely and virtually, and they're just overwhelmed. They just can't see everybody who's needing their services. So one of the things that we're focusing on right now is really growing that program significantly in size. Not just because of COVID, but even post-COVID, there's going to be a lot of ripple effects of this from a mental health perspective. There'll probably be some sort of PTSD light kind of reactions that people may have going into the future. And so really important that we hear that need and respond to that need, which has been so core to how Medcan has been developing, not just this year, but for many years under Shaun's leadership. So the times are changing, and again, we're at the point right now where we can maybe just see that we're about to turn the corner. Certainly in Ontario, that's sort of where we are at this point. South of the border, a bit of a different story, a patchwork, and lots of hot spots and some spots that frankly haven't seen many cases at all. Some of the challenges that we're facing in Ontario right now in terms of the actual case rates and trying to get the testing up, that's been a challenge. And certainly 3 levels of government have been very aggressive in terms of trying to get the case rates up, because if we don't have the case rates, we can't do the tracking, and we can't actually understand sort of what's happening in the general population with this virus. So that's been a bit of a focus. You know, I've been asked, you know, why aren't we at 13,000 a day? And that I can't answer, because, you know, there are logistical challenges in terms of ramping these tests up across a very large geography. It might be easier in an urban environment like Ottawa or Toronto, much more difficult in the north, where maybe our communities are quite remote. So that's one of the top items that we're picking up from the media, of course, in Ontario, similar across all provinces. I will say one of the things that's been topical for us here in the GTA and in Ontario specifically is the ICU capacity. So in hospitals, as Shaun hinted, and in his op-ed piece, shone a light on the fact that our health system is always operating at essentially 100%. There's no surge capacity built into the system. So even on a regular year, you know, when we have a bit of influenza, it basically shuts down our system for a month or two, you know, through December and January specifically. So obviously a system that is that fragile is, you know, could not deal with this. And so one of the things that we did early on, and again, we saw this coming in February, so we're able to get in front of some of this, and both here at Medcan and even from a provincial perspective. And one of the things that the Ministry of Health did very early on was start to anticipate that surge. And they actually planned the surge in terms of demand on the ICU at 160%. So not adding sort of 10% capacity or 20%, literally adding 60% capacity across all of our hospitals in terms of ICU beds and ventilators that, of course, would have to go along with that. Fortunately, what we've seen, because Ontarians as a whole have generally followed the guidelines that have been put out in terms of physical distancing, hand washing, just not touching your face, staying apart from people that may be sick, staying apart from highly vulnerable people too. So people that are frail, seniors that have chronic illnesses that are highly at risk for doing very badly or potentially dying of COVID. People are sort of getting that message. And as a result, the demand on our ICU capacity has actually been less than anticipated. And over the last number of days, we're actually flatlined. We have about 200 people in ICU beds at this point, and we have significantly more capacity than that. So that's really encouraging at this point. We're not out of the woods by a long, long shot. As again, you're going to hear on the media, we're turning a corner. The turning the corner just means that when we turn the corner, we might be able to see the horizon. So it doesn't mean we're turning the corner and everything's going to go back to normal. I think generally what we're going to see in May is the essential business list will probably start to grow a little bit longer. Obviously, it's been squeezed down. And I think the next thing we're going to see in May is a little bit of a relaxing as we start to inch back to what the new normal is going to be in the future. So that's sort of where we are. Essentially, we're at the end of the beginning right now. There's lots of activity that's going to be happening on the healthcare front to try and keep a handle on where we are. Keep the pedal to the metal in terms of the social distancing, which should become almost sort of second nature for people. Keep the case rates climbing so that we can get a really good sense of getting in front of this thing as much as we can. You'll notice some of the numbers coming out of BC are extraordinarily encouraging. They jumped on this very aggressively and very early, a little bit quicker than Ontario, and as a result, their overall impact is currently is actually much less than in Ontario. So with that, I will turn it back to Chris. I know, Chris, we had a couple of questions that were already put forward.
That's right. Thanks very much for that, Peter. And I'll just add to the webinar attendees, you can submit questions by chat. We received numerous questions through email, through Instagram, and through the various other social platforms. So we're going to start with those. So this is from Instagram. I think this is a great question. Why will we all eventually get COVID-19? We don't all get the flu during flu season. Peter, I'm going to hand that to you. Why will we all eventually get COVID-19? And is the premise of this question actually a bit problematic? Go ahead.
Yeah, no, it's a bit of a leading question. And number one, we actually might not all get it. We all might not be exposed, but part of it is determined by when we have a vaccine that'll ultimately signal the end of this. That vaccine is likely to be next winter sometime before we can get that broadly distributed. So that's a bit of a challenge. If without the vaccine, eventually almost everybody will be exposed at some point. It's not a matter of if, it's when. Partly the difference between that and influenza is the fact that, frankly, the highest transmissibility of this particular virus happens before the person actually has symptoms. That's the crux of the problem globally. If we had whereas influenza is more transmissible when we have symptoms. So that's the big difference between these two similar, in other ways, coronavirus. And that's why ultimately we don't all get exposed to influenza in a given year. Although many of us get exposed even to influenza and don't really mount a lot of symptoms. We had a bit of a runny nose for a few days. And if we could do the antibody testing, we would actually find that we have the antibodies against the flu. It's just that it didn't feel like the flu. And that's exactly what's happening with COVID. We have many people that will be exposed and have either no symptoms or very minor symptoms that they might not even recognize as being COVID related. We're finding out right now that there's about 20% of people that are infected with COVID actually have gastrointestinal symptoms. So they have GI symptoms, abdominal pain and diarrhea, which up until now, we wouldn't have even sort of raised an eyebrow in terms of being a COVID carrier at that point. So the symptoms are different. We all might be exposed. It all depends on when the vaccine to the virus is going to be ready for distribution. But ultimately, if without the vaccine in place, there's a good chance at some point we'll all be exposed. But whether we have symptoms is up to the individual sort of immunity and the individual's makeup, the age, and if they have any other comorbidities that are putting them at risk.
Thanks, Peter. This next question came in by email. We think it is possible our family had the virus back in late February or early March. I would love to know, is there a test that can detect whether you've had the virus in the past? If so, where and how can we get tested? And has it been determined you cannot get it twice? Peter, I think that's to you again.
Yep. Yeah. So there's in fact a very interesting test that is just in front of Health Canada for approval. It's been approved by the FDA and in the European countries as well. And it's as opposed to the nasal swabs that you see that on the media, and if anybody's been to an assessment center, this is done with a drop of blood. So it's kind of like a glucose test, sugar test, where you get a drop of blood from a finger prick, drop it into a little cassette, and within 15, 20 minutes, it'll tell you whether you have the antibodies, which we call IgM and IgG, those antibodies specifically against the COVID virus. So that immunity will happen as if somebody has mounted symptoms, a fever or a cough. Essentially, we know that that person has got an immune response because the fever and the cough are the body's way of killing or getting rid of the virus out of the system. And so as we start to move through the lifespan of the virus, we start to see more people that will be immunologically protected against that virus. So if their immune system is charged up, if they see that virus again, they won't actually react. It'll kill it on contact. And so for the most part, there is protection. The challenge we have is we don't know how long that protection is going to last. So we don't know. Some people mount a very robust immune response. Some people a very weak immune response. For some people, those antibodies will build up, and then in a number of weeks, they might be diminished to the point where it really means that you're susceptible again. I think most people, and again, these are early days because, think we're only in month 4 of this globally, but early days, but we think if we look at influenza and some other models, that most people, and again, there's a bit of a bell curve, most people will end up having an immune response that lasts for at least a few months. So not weeks, not years, but months. And during that time period, they're quite protected against getting the COVID-19 virus. The footnote here is that in the future, the virus will mutate. There will be more strains. And so even if we are immune against the particular strain of the day, it doesn't mean we'll be protected in the future.
Chris, I could just add on that Peter and I have both been inundated with manufacturers who are producing these, especially in China. And Peter, I think, headlined it quite succinctly. First of all, we thought maybe this would be an immunity passport of sorts. And as we've dug into it, the reliability of these tests in terms of your immunity, we simply, it's not there yet, as Peter has outlined. And then second, the reliability of the manufacturer is not there. I think the UK initially, in fact, they may have bought 17 million kits, and then physician professor groups have pushed back and have said they're not reliable, and in fact have gone through 80 different manufacturers in that process, but hope within a month or two there will be some reliable antibody testers. So I get lots of questions from people who say, I'm in Florida and my doctor just emailed me and says he has access to a great test. Typically, these are antibody tests. And I'm just not, I know very few that are so far FDA approved. And so far in Canada, I don't believe anyone is approved yet. So just FYI for our listeners.
Mhm.
Thanks for that, Shaun. So stay tuned. Next question, this came in by email in advance of the webinar. I'm wondering what Medcan's thoughts are on best practice health precautions that companies should be taking when the economy opens up and people start coming back to work. Do you have ideas on ways to maintain distancing within an office environment? Are masks necessary in the office? Should we limit the number of people in the office? Shaun, why don't you start with this? And
Yeah, Chris, can you hear me okay?
Yep, absolutely.
Yeah, okay, great. So that, look, it's a great question. I mean, we've been obsessed, obviously, with dealing with the stay-at-home, the lockdown, the unfolding statistics around the virus, and of course, just as bad now is the economic catastrophe that's unfolding. So I think getting back to work is on everyone's mind. And, you know, we've been in full flight with employers large and small about how to do that safely. And, you know, we're taking guidance, obviously, from public health and the information that continues to unfold for us. So, for example, I just mentioned how we thought maybe the antibody test would provide some sort of immunity passport. It may not do that, or it may do that in 2 or 3 months. So this is something we need to stay on top of, literally week to week. What I can tell you is that we're working with employers at different levels to help them make their employees confident to be at work for those essential workers, and to then deal with a situation where they may have a COVID infection. What do you do then? And then, you know, generally when essential or non-essential workers start to come back into the workforce, how do you manage that too? So it's really unfolding day by day. And we are in a place where we expect to be able to support our employer clients. I'll pass it over to Peter, who's literally on the front line working with many of them right now, to comment further.
Yeah, so thanks, Shaun. Yeah, so we're working with a number of very large, you know, global clients, and similar, almost regardless of the size, the questions are the same. And you know, what is first about how do we deal with the very rapid escalation in terms of the risk profile in that sort of, and that was, you know, a number of weeks ago. Now we're kind of stabilizing. Employees are getting used to being, you know, at home, working remotely as much as we can. There are some core sort of mission critical roles that just need to be on site. And so there are, and then when those folks are coming on site, what does that mean? And for sure, distancing, the physical distancing of at least 2 meters. And then, you know, the part of the question was around masks, and the use of masks at some point has sort of changed. And that happened about 10 days ago when Dr. Tam and the CDC almost at the same time came out with some comments about maybe masks, where they were sort of downplaying the role of masks. Now sort of said, well, there are situations that masks could be useful. And so we get a lot of questions about masks, both just in general population and certainly in the employer world. And basically what I've said is, you know, think about these surgical masks. They were created for surgeons in an operating room. And they weren't wearing the mask because they were afraid of catching something from the person they're operating on. They're afraid of giving that person in an open wound some sort of an infection that came from them. So the masks were designed, and they're very good at keeping droplets in. They're not really good at protecting us from others. And so, and that's been stable. That hasn't changed at all. And even Dr. Tam, if you read it sort of between the lines, she actually was saying that, and the CDC has said that repeatedly. what has happened is when you have a prevalence in the population that gets to a point where a lot of people are actually susceptible, and many people actually have the virus, and they're shedding the virus when they don't even know they have it, like we were talking about before, it does actually make some sense that you start to have people wear masks, not to protect themselves against others, but protect others from them. So when you see people wearing masks, you think, well, they're wearing them to protect themselves. In fact, the message is slightly different. We want people to wear masks because they might be the ones unwittingly passing on the virus to their loved ones, whether that be in a home environment or a work environment. So for those essential workers that need to be at a business site as opposed to working from home and remotely, moving more towards thinking about on a limited basis mask usage, but it doesn't take the place of social distancing. It's in addition to physical social distancing. And I have a strong sense that that's going to become part of our new norm as we progress through this over the next months and years.
Thanks, Peter. We have a question that came in through the course of the webinar, and it seems funny when snow was falling a few moments ago to think about, but this is something that I think this is a good question. Is warmer weather helping with COVID-19? Peter, do you want to take that one?
Sure. Yeah, really not too much. The thing that's going to help us is generally we don't have flu seasons in the summer because flu becomes its own mini epidemic, influenza, because we're all close to one another and passing it on. In the summertime, we tend to be farther apart. We're up north, we're at the cottage, we're keeping apart from each other. It's a little easier to keep apart as opposed to huddling together in places of business or in your home. And so that's why in the summertime, we tend not to have a flu season. We're already pretty apart from each other at this point. So I don't think that's going to make much of a difference. I think the timing is that over the next month or two, we're going to see that we're going to turn the corner. We're going to get ahead of this thing, and we're going to start to open up and get back to business as usual over the summertime. It was a timing thing, and I think this particular virus can certainly live in any kind of even quite inhospitable environment. And so it's just more of a timing thing with this. And we can expect that as opposed to a traditional virus sort of season, where this particular virus, at least for the first year until we have a vaccine, may come and go at will.
Thanks for that, Peter. We're coming up to the end. We'll take one more question. And sorry, folks, I'm just, so this is about public transit. Post-lockdown, how should commuters travel by public transit? Should they sit next to each other, not knowing if anyone is infected around in the car? Peter, why don't you take this one? So it's the challenge of public transit in a pandemic world.
Yeah, and I think, at this point, we're going to be so ingrained with that slight bit of nervousness about being close to people that's going to become a bit second nature. So I doubt people are going to be very comfortable for the next year or more, even after a vaccine. Maybe it may become part of our DNA that we're going to be a little nervous whenever we're close to people, and frequent hand washing, that using the Purell, which we should be using when you're using public transportation. Using a mask, again, for the reasons that I described, not to protect yourself necessarily. Social distancing, keeping, the TTC, for example, in Toronto, and reflective all the different agencies for public transport. They're doing just an awesome job at cleaning. They're doubling down in terms of their antiviral cleaning of the vehicles. So that part, at least at the beginning of a day or the beginning of a shift, you can be sure that things are clean. But during the day, people are touching things. And as we know, some surfaces can hold on to that virus for a couple of days. So you just basically, it may not be possible not to touch things that hold on to a pole or get up using your support with your hands. That just means as soon as you are either during the transport or even after you get off the vehicle, as soon as you can, just use your hand sanitizer, Purell, don't touch your face. And the more we can just break those lines of transmission, the more we're going to be just as healthy as ever.
Thanks, Peter. That's all the time we have for today. Before we leave our participants, I wanted to talk about future webinars. We'll be doing this on Tuesdays and Thursdays at 12:30 regularly throughout this. The next one is Tuesday, April 21st. That's a mind health session with Dr. Gina DiGiulio. After that, Thursday, April 23rd, there's return to work strategy and guidance, which will be with Shaun Francis and Ashim Kamani. From there, we'll be doing Tuesdays and Thursdays after that. We also are posting actually quite a bit of content from Medcan. You can find us on Instagram at Medcan Livewell. You can find Shaun, you can follow Shaun's podcast at eatmovethinkpodcast.com. We're also updating through medcan.com, the site. Thanks for joining us, and I really appreciate everyone's questions. It was great, and stay safe and be healthy. Thank you.